I'm excited to introduce Sara Dube, who many of you know through her work as the project director of the Pew Results First Initiative, where she manages the initiative's work to advance evidence-based decision-making by states and counties. And so building on Lauren's description of Colorado's work, Sara is really well positioned to talk about what are some other models of state performance management and how that information is being used for budgeting and also in engaging state legislatures. And so after her remarks, we'll also have some time for some Q&A. And so if folks want to pop those into the chat as they come up during her remarks, that would be great. And so Sara, over to you. Look forward to hearing about the important role that performance information can play in helping states achieve better results. Sara?
Great, thanks, Jed. Hi, everybody, and thanks again to Jed and to Josh for inviting me to be here today, and to Results for America and the National Governors Association for hosting today's boot camp. So it's so nice to see so many familiar faces, even in these tiny squares that have become so familiar to all of us recently, and to talk about important topics that I think we can all agree have become even more important in recent months. Though I could certainly talk all day about the importance of setting strategic goals and building a culture of evidence, I'll focus my time on one managing for results strategy, which is the importance of using data to help manage program performance, advance goals, and support continuous improvement. As many of you know, and as Jed and Lauren very kindly mentioned, for the past decade, Pew's Results First Initiative has been helping state and county leaders use evidence in a variety of forums so that they can make the most of limited resources while generating positive outcomes for residents. And one of the ways that we've done that is by producing lots of applied research and sharing examples of effective strategies from jurisdictions around the country. In 2014, we released a framework highlighting 5 key components of evidence-based policymaking, featuring measuring and monitoring outcomes, as you can see here, as one of those key components. And Isaac, I just have a little highlight there, if you could just advance quickly. Thank you. So obviously there's a lot of important things here, and you know, I think we can all agree that it's important to do all of these things to assess programs, to ensure that you're providing the right ones, to the right populations, to ensuring that evidence of program effectiveness is ideally used in developing budgets, to implement programs with fidelity to their original design, and to evaluate their impact. All very important. But this key component on outcome monitoring and measuring performance is really important because it's about programs achieving the results that policymakers, providers, and the public expect. And again, while everything's important, I'll focus on this one today and talk a little bit about why we think it's so critical. If you could go to the next slide, Isaac. Thanks. So most states have performance measurement systems and data in some form, whether folks know about it or not. And that's for a few reasons. States have these systems and data because it's fairly intuitive to want to know how your investments are performing, and because some form of performance management has been around for a long time at all levels of government. But at the same time, lots of people don't know about their state's own performance management systems because it can be an isolated effort that exists in just one office or a handful of offices, and is not generally communicated very well to decision makers or a wide range of stakeholders. So as you can see here, this is an excerpt from a brief we put out back in 2018 that digs into measuring program performance, specifically how states use performance data to improve their programs and services, and then strategies for improving the performance management systems themselves. And as you can see here, performance management systems vary quite a bit. And I should mention, this is certainly not an exhaustive list. This is just a sample of what we found when researching this brief. The systems that state use generally depend on the goals and intended audience, ranging from public accountability, making program improvements, informing budget decisions, and sometimes more than one of those things. One is not important, more important than the other. It's all important and all needs to link back to your goals and intended audiences. But when you want to use performance data in a broader results-based budgeting system, you need to ensure that your performance systems and data align with those results-based budgeting goals. For example, Maryland's Managing for Results process, which was highlighted in the blueprint, is notable not only because it tracks agencies' performance data and does that pretty well, but also because it reports that data alongside budget information, aligning the performance management and budget development processes in a pretty natural way. Yeah, there we go. And even if states have performance management systems and stakeholders know about them, which is great, you're off to a good start. People running those systems can sometimes miss the next step of connecting their work with other evidence-based policymaking efforts. Could you advance, Isaac? Thank you. You know, our work with states, including many of you, as Lauren kindly referenced, and our research has revealed a few strategies for successfully making those connections. They're all pretty intuitive, but I think they're all good reminders of things to make those connections even more successful in times when people are you know, overwhelmed with a lot of different things on their plate. So the first is to help ensure performance data are available and ideally used in the budgeting process, as they are, for example, in Maryland and certainly in Colorado. And while, of course, there's no guarantee they'll be used, a few things can help improve the likelihood that they will be. First is to hold regular meetings between leaders, including budget staff, to discuss progress toward achieving goals and then making adjustments as needed. Performance management leaders can also report data in a way that's user-friendly and connected to the state's broader goals and strategic plan. And the type of data that's reported and the form that it's reported really links back to those overarching goals and intended audience, something that is really intended to strive for public accountability might look different than something that is looking to affect the budget. And then ideally, performance management, oh no, back to the slide we were on. Thanks. And then ideally, leaders take the next step to start integrating the performance management efforts with other evidence-based policymaking efforts. So people know about the data. They hopefully have a plan to use it in decisions they make. So next step is to integrate multiple efforts together to ensure that, as Lauren said, it's really part of the day-to-day work, which is how this work generally tends to stick and be sustained. Performance data are certainly important, but they shouldn't be the only type of evidence that leaders consider when making budget decisions. It's important to take into account all other types of information, like local program evaluations, the national evidence base that you can find in research clearinghouses, and process improvement initiatives, to name a few. Just wanted to share an example from New Mexico, which is one of Results First longtime leading partner states. The Legislative Finance Committee's Legislating for Results framework has done this integration very well. So first, at a high level, they look across agencies to see how programs are performing and then identify areas for further analysis. And then next, they dig a little deeper to review research on program effectiveness and rate those programs. And then they use all this information, their performance data, their program evaluation results, and benefit cost analysis to identify the programs most likely to generate positive outcomes for residents, and then also a positive return on taxpayer investment. And they use all of that as the foundation for their budget recommendations. It's a lot of work, but it works. So as a quick example, a few years ago, after observing consistently low literacy rates among the state's children in that first surveillance step, so looking at how things are working across agencies, LFC analysts reviewed the data to determine the potential causes of this challenge and then proposed solutions supported by strong research. They came up with pre-K as an effective investment. They conducted a program evaluation that conveniently found positive long-term results and then recommended additional funding for pre-K programs. And subsequently, they found the percentage of participants reading at grade level in both kindergarten and third grade had improved. As I mentioned, that was a few years ago, and those numbers have steadily increased over time. Okay, now next slide. So why now? You've all got a lot on your plates. There's a lot happening. And I would say that that this is more important, maybe not than ever before, but certainly very important now and something to focus on. While relying on data and evidence to make spending decisions has certainly proved useful in times of prosperity and might even be fun, as Lauren said, it's even more critical now as the challenges that you all are facing are increasing. And you are faced with decreased revenues and increased spending. You don't have to have rigorous benefit cost data or a sophisticated performance management system to make informed decisions. You can use existing data to identify which programs are meeting new and changing community needs and achieving desired outcomes, and then make smarter choices about how to steward those limited resources. Quick example, I know we need to wrap up in a minute, but in Utah, the Office of the Legislative Fiscal Analyst analyze the availability of medications and behavior therapies for opioid use disorder, which is a crisis that appears to be worsening during the pandemic. And they did that to highlight gaps in services. And they found that the counties with the highest need for treatments also had the lowest availability rates. So the plan is to use that data, target limited funds, increasingly limited funds, to the areas and populations of greatest need. It's too early at this point to tell both the fiscal and human impact of this assessment, but it's a good example of how leaders can use the data that you already have access to inform decisions about how to prioritize decreased resources. So in closing, I just want to reiterate that even with declining revenue, it is possible to maintain programs that ideally, according to the data, are most effective at meeting community needs, ideally saving the deepest cuts for ineffective programs and the ones that may certainly serve an important purpose, but are just not as critical in this moment. If you just go to the next slide, there's a link here to our project website. You can find more information here on our project site. And at our, evidence-based policymaking resource center, which organizes both strategies and examples from states and counties around the country by the 5 key components that I mentioned. And it looks like there is a link to that resource center in the chat. So I will end there.